Hello, everyone, and welcome to Functional Fertility, the podcast designed to demystify your hormones, up-level your lifestyle, and supercharge your fertility potential. I'm your host, Dr. Kalea Wattles, and I'm excited because we're going to continue our conversation today on the hypothalamic, pituitary, adrenal, thyroid axis. And I have the perfect guest with me, functional registered dietitian nutritionist, Nicole Fennell. Specializing in thyroid disorders like Hashimoto's and hypothyroidism, metabolism support, gut health, Nicole and her team at Choose Food Wisely are passionate about helping women uncover the root causes of their symptoms, combining the patient's story, symptoms, and specialty lab testing to craft personalized, realistic plans that fit each person's life. She is my go-to for all things thyroid. Welcome to the show, Nicole.
Hello. I feel like this has been such a long time coming. Thanks for having me.
The listeners need the background that we've been friends online for years.
A long time. Like I think at least since 2018 or 2019. So it's been a while.
It's time. It's time that we have united to talk all things thyroid. And
Yes.
I have to say, whenever I open up what do you guys want to talk about on the podcast? Everybody always wants to talk thyroid because I think so many people maybe they suspect there's something going on with their thyroid, or they have been told they have a thyroid diagnosis, but they don't really know what it means. So we're gonna unpack it today.
Yeah. I mean, I would say that thyroid issues, if you don't have one, you probably know somebody that has one, or like you said, you suspect that you have one. So it can infiltrate every aspect of life.
I find that more and more of my patients are coming to me, probably because they're reading Instagram accounts like yours that make information so accessible and so approachable. And they're like, okay, I've done some reading and no one has really looked into this, but I think there's something going on with my thyroid. Does that happen to you all the time?
Oh, yeah. Yeah. I would say a huge portion of the people that I want to talk to and are trying to talk to and do talk to are the people who are like, ooh, those symptoms sound a lot like me, but I don't know if I have a thyroid issue. I feel like thyroid issues are so common that they've kind of been normalized at this point. And the diagnosis, while it can be straightforward, sometimes isn't always straightforward because of just the way that the labs present themselves. And so I think that it's really important to open up this conversation about common symptoms and also like the best way to really start to understand what's going on with your thyroid hormones, to start to uncover things that could be a problem before they get to the point of a full-blown diagnosis. And so with thyroid issues, it can kind of fall on a spectrum. And I want to catch people wherever they are in that spectrum to help them to feel better. Because golly, if you have a thyroid issue, you know how terrible it can feel. And we want to help people feel better.
Yeah. Well, listeners of the show will know I always talk about the preconception screening where I'm doing all the thyroid labs. Like it's about your fertility and getting you ready for a healthy pregnancy, but it's also about catching those early signs and symptoms of chronic disease like Hashimoto's or just hypothyroidism, metabolic issues, chronic inflammation. So it's really about kind of supporting that longevity in our health that allows us to enjoy this family that we have worked so hard for. So you mentioned screening for those common signs and symptoms. And I actually think that's a great place for us to start.
Yeah.
So will you just talk to us a little bit about what are the things that are raising your index of suspicion that there's something going on with the thyroid?
For sure. So I would say it's going to sort of be in layers or tiers because, thyroid symptoms are vast. Thyroid hormones touch every cell in the body. And so whether it's from your head to your toes, like you can have symptoms related to thyroid issues, but there are some that kind of wave bigger flags than others. And so one would be crippling fatigue, and maybe not even crippling, but just knowing like, I just don't have the energy. Yes. And a lot of times it's daytime fatigue and nighttime restlessness. So if you're at the point of like, I'm so tired, I just want to go to bed, but you have a hard time going to sleep, to me, that pings, ooh, we need to check what's going on with the thyroid. Feeling cold, losing hair, having a difficult time with weight management. So whether it's difficulty with weight loss or maybe it's weight gain, digestive issues. So that can be bloating, constipation, alternating constipation and diarrhea, hair loss. So hair on your head and then like eyebrow loss. Those would be like pretty obvious signs, but some other like not so obvious signs would be like menstrual irregularities, feeling just like less motivated, feeling kind of down in the dumps, like thin nails. Those would be other things that would suggest thyroid dysfunction. But like I said, thyroid hormones influence every cell. And so there's really no symptom that's like off limits. And so if you're having these like recurrent symptoms, it's usually not coincidence. There's usually a reason why. And I would say that testing and assessing your thyroid situation would be honestly one of the first things that I would recommend if you're having these symptoms that just won't go away.
Mm-hmm. And like you said, because the thyroid hormone is so important for every tissue type, that's part of the reason why diagnosis can be challenging, right? It's because it's not specific. It looks like so many other things. It looks like iron deficiency. It looks like low B12, all of these other things. I had a patient the other day that has really low thyroid hormone and she said, every day I feel like I'm in water. Like my body has so much resistance. That's how she described her fatigue. And I was like, wow, I actually hear people tell me that it's like a heaviness to their body.
Yeah. I mean, it slows everything down. So if you think about thyroid hormones kind of like gas in the tank, when they're low, or maybe your cells aren't utilizing them appropriately, it just kind of slows everything down. And it can make things like your muscles feel heavy because they help to stimulate that muscle contraction. So like I said, the symptoms are so wide ranging that sometimes it can be sort of like a moving target to figure out, like, is it the thyroid or is it not the thyroid? And so that's why I'm a huge advocate for testing and not guessing, and either confirming or ruling out or catching things before they become a big thing, being more proactive versus reactive when it comes to your overall healthcare.
Absolutely. Let's talk testing for a minute before we move on, because I know you and I agree TSH alone is not enough. And many, many, many patients come to my office having only had a TSH, that's the only thing that's ever been measured. Will you walk us through some of the other biomarkers that you're looking for a more comprehensive profile on thyroid function?
Absolutely. And I always like to give a little bit of a disclaimer that I am not anti-TSH, just like I'm sure you're not anti-TSH. I think that there's so much value to it, but it's almost like having the Cliff's Notes of what's actually going on, as opposed to reading the full novel. Like you just can't appreciate the beauty of what's going on if you're only reading the Cliff's Notes. And so the TSH is a brain hormone, and it's stimulated. It's going to increase in the presence of low thyroid hormones and decrease in the presence of high thyroid hormones. With an asterisk, that doesn't always happen. Because it's coming from the brain, there's so many other factors that can influence it, like stress, whether it's physical stress or emotional stress, that can actually suppress the excretion of that. And so what I find that is very valuable is looking not just at the TSH, but what's actually going on with the hormones. And so looking at the total T4, the total T3, the free T4 and the free T3, so the hormones that are free and available for use. Looking at antibodies. So if there are thyroid issues or thyroid hormone issues going on, is it related to immune system issues? Or is it related to something else? Is there a potential root cause that's related or not related to autoimmune? I like to also look at things like reverse T3, thyroxine binding globulin. And so those combined would be how I would kind of like first tier start to analyze what's going on with the thyroid hormone situation. And then the next tier would be, okay, how well are the cells using the thyroid hormone? How well are they absorbing them and able to like actually use the hormone to support the metabolic processes? And that's where looking at different vitamins and minerals could come into play, because those vitamins and minerals are what are going to allow that proper cellular communication, so that your body can actually utilize those thyroid hormones that are there.
This is why I love kind of a functional approach to how we manage thyroid, because like you said, TSH is so valuable, and it really helps me as a clinician make decisions about medication management, for example. So it's absolutely crucial. But I love the way that adding on those additional biomarkers helps me understand how the brain and the thyroid are communicating. And there's like this bidirectional communication, right? And I want to make sure that that line of communication is open. And sometimes I'll even say, like, we want to see if the brain is talking to the thyroid with an inside voice. Or is it yelling? So it gives us some indication of the etiquette that is happening in this conversation. Hey everyone, it's time for this week's Fertility Supplement Spotlight, brought to you by Needed. If you're doing your life audit and one of your wishes is a pregnancy in the next year, There is no better time to start a top-notch prenatal vitamin. Right now, get that prenatal on board. Needed is my go-to for perinatal supplements. They prioritize ingredients I trust, and they develop each product with real moms and moms-to-be in mind. I personally take the prenatal vitamins, egg quality support, CoQ10, and prenatal omega-3s, and I love every one of them. But a standout is their prenatal multi. It's available in both capsules and a delicious vanilla powder. This powder is a game changer for anyone dealing with nausea or you're just tired of taking pills. Needed isn't just beloved by Functional Fertility. It's also recommended by over 6,000 doctors, midwives, doulas, and nutritionists. And it's the first perinatal nutrition company to be B Corp and climate neutral certified. If you're ready to elevate your prenatal wellness routine, head over to thisisneeded.com and use code Functional Fertility for 20% off your first month of products. That's thisisneeded.com and use code Functional Fertility, all one word, for 20% off your first month of products. Of course, this show is all about fertility, and I am such a proponent of screening the thyroid because of all the effects in the reproductive system. Will you talk to us a little bit about how our thyroid health impacts our fertility, our ability to conceive, and our ability to carry a healthy pregnancy?
Absolutely. And so I think before I answer that directly, I think it's really helpful to set the stage for our body being like one big communication axis. And so we have something that I like to refer to as the HPAOT axis. So the brain, the hypothalamus pituitary, adrenal, so your adrenal glands or your stress hormone centers, your ovaries and your thyroid. And so they're constantly communicating. And if you think about those sort of like a table with four legs, when one of those is off, the whole table gets a little bit wobbly. So whether it's the adrenals that are off, or it's the thyroid that's a bit off, or the brain is under a lot of stress and that kind of makes the whole table wobbly, that's going to influence the ovaries. So a lot of times in the presence of hypothyroidism or low thyroid hormones, there's going to be an increase in TSH. And what simultaneously often goes up with the TSH secretion is prolactin. And so the elevation of both of those together can interfere with ovulation. So ovulation in the menstrual cycle is kind of the star of the show. And especially when you're thinking about fertility and conception, without ovulation, conception is like not possible. Like you have to be ovulating.
Yeah.
And so that would be like the biggest way that hypothyroidism can influence fertility. There are other factors, but that's going to be the biggest way. Taking it deeper, again, I think it's really, really helpful to appreciate that table analogy and to see, well, if the ovaries are underperforming for whatever reason, what else could be going on? Like, how do we balance this table as best as possible? And so one of the big things that we focus on is what I call the thyroid hormone journey of not just assessing, are the thyroid hormones low? Sometimes the thyroid hormones look great and the TSH looks great, but the cells aren't able to take up and utilize the thyroid hormones. And so the thyroid hormone journey is like this cascade of events that happens from the brain to the thyroid to the body being able to pick up and use the thyroid hormones. That whole process needs to be fine-tuned, and that's going to be really heavily influenced by diet and lifestyle. And so when it comes to hypothyroidism, there's so much that we can do with improving diet and lifestyle and adding in the right foods and tweaking lifestyle accordingly to help with that entire communication access.
Yeah, I think that's why it's so powerful that, I think you and I will both agree, medication can certainly be part of the treatment story, but also those nutrients, the lifestyle component. We know that we have tools, non-medication tools, to help support, the conversion of T4 to T3 and to help support cellular sensitivity to thyroid hormone. And that's why it's so beautiful to be able to combine all of these things together. So love that we're starting to roll these into the story. And I think something that you talk about is monitoring your body temperature. And a lot of my patients are doing their basal body temperature every day because that's, how they're identifying their fertile window. But there's so much insight that we can get from our body temperature about our thyroid function. Will you tell us about that connection?
Yes. Oh man, this is something, how can I keep this like concise and not just completely go off on a rabbit trail? Because I think that data is so helpful. And if we could get lab tests done every day, like how cool would that be? But that's just not realistic. And who has time to do that? But Our body speaks to us in the most beautiful ways if we are able to sort of like understand what the communication means. And our body temperature is a really good indicator for what's going on metabolically speaking, or in other words, like what's going on with our metabolism. And metabolism a lot of times gets boiled down to like your weight status and like what you look like, but metabolism is much more than that. Metabolism is our body's way of taking food and turning it into energy or turning it into heat. And one of the big ways that thyroid hormone influences our body is it's sort of like the ringleader of the metabolic processes. So if your body temperature is consistently low, and what I mean by low is usually below like 97.5, 97.6, below that would be considered low. That's going to be an indicator that your cells aren't taking up thyroid hormones and using them appropriately. And so one of the metrics that we use with our clientele outside of lab testing would be a basal body temperature, not only for tracking hormones to see like, did ovulation occur, your luteal phase, all of that, but also by seeing how well your body is responding to thyroid hormones. And if your cells are being able to take up and utilize the thyroid hormones to help to increase the body temperature, to increase the heat, because it's helping to improve the metabolism.
Mm-hmm. So is this something when your patients are tracking their temperature, you're working on their thyroid health, it's getting better. Do you see their kind of set point for their temp go up?
Yes, it's amazing. So for some people, it's going to be pretty specific to the person. And also like depending on how low they're starting, but we've seen some people jump a full degree. So sometimes people will come into the practice and they're at like a 96.7, and then they'll jump up to over time to a 97.7. And what's really neat to see is, of course, with the cycle, the temperature is going to adjust, and being able to see, like you said, the set points start higher. And so, kind of like adjust accordingly also with their menstrual cycle. So it's really neat. And what we emphasize is like, what are the foods that we can add in and the lifestyle factors that we can adjust to help the body to feel safe enough to increase that metabolic rate? Because a body that doesn't feel safe is not going to increase the metabolic rate, no matter how much thyroid hormone you're throwing into the body, like via medications. We really have to make sure that the body feels safe. And one of the biggest ways is through food and being fed consistently in the right amounts with the right types of foods that your body needs.
We talk about this a lot around here in functional fertility world about like all of the information that the body is taking in to decide that you're safe. And the conversation comes up around reverse T3 quite often, right? With it being this metabolic break. And I try to convey that it's not reverse T3 is not the villain. It's actually compensating because it feels that there's some need to slow the rate that you're using energy to protect you. And then it's our job to figure out, okay, well, what are those factors that are making your body feel like, wow, I really need to slow down and conserve energy because something dangerous is happening here.
Yes. Yeah. I love reframing, as somebody who was a chronic dieter that was just so hard on my body for a very large percentage of my life. I have found that reframing is so helpful, and like just reframing how we view our bodies, and that our body is on our side. Like our body and our brain, like we are one cohesive unit. And so, I think that it's important to recognize that your body always has your back, and its primary goal is safety and survival and keeping you safe at all costs. And so when we have these symptoms, those are like the cues or the red flags that says like, hey, something is off. And they're meant to be annoying, and they're meant to get your attention because it's trying to get you to make a change so that it's not feeling this like lack of safety. Because it's going to do just that. When it's feeling unsafe, it's going to turn down the metabolism, which is going to make that whole table wobbly.
I'm going to pose a scenario to you that I'm going to just be fully transparent. I find this challenging in clinical practice, partially because of just my own experience with this scenario. Here it goes. Are you ready?
Yeah.
You've shared that, you grew up in diet culture too. The same as I did. We grew up in the era of, 17 magazine and Victoria's Secret angels, and diet culture is everywhere, and it's so ingrained in us. And many of us, I think, struggle with being in an energy deficit because we feel like we need to maintain some weight or body image.
Yeah.
And then that comes up in clinic when we see the low body temp or we see low gonadotropin hormones,
Yeah.
FSH and LH. And then we need to have this conversation about how our body decides it's safe and maintaining healthy energy levels. This is a hard conversation for me to have because I get it. It's so loaded. It can be so activating for many of us. Just will you give us some pro tips about how you approach this very challenging conversation?
Yeah. I think the biggest thing, and this is something that it is a hard conversation, but a necessary conversation, is just continually striving for grace and compassion toward your body. And for some people, getting the education and the understanding is the light bulb moment. For other people, it's really uncovering the roots of where those feelings are coming from. Because like when we have these feelings, it's usually tied back to experiences. And so I think that it's really important to be able to unpack that, and to just continually try to change our posture towards ourselves to get to that point of grace and compassion and understanding. And for some people, it's quick, and for other people, it takes a long time. And as a healthcare provider, it took me a really long time. I have my master's in nutrition, and even during that, I was still like, I need to run more and I need to keep my calories low.
Yep.
And for me, I had to learn the hard way. I developed an autoimmune disease, actually multiple autoimmune diseases. I felt terrible, like in my 20s when I should have been feeling my best. So for me, I had to learn the hard way. And my hope and the whole reason I'm in this field is to like help people not have to learn the hard way through education and feeling empowered, and to make food not such the villain, and to make their bodies not such the villain, to be able to really approach the body with care and with curiosity. And when symptoms arise, instead of getting frustrated about them, get more curious about what that could mean. And then start to know not just what they mean, those symptoms, but like how to respond accordingly. So it is a challenge, but it's a good challenge to tackle.
Yeah. And how beautiful this process of developing some trust in our body. Like, I'm going to give you the things that you need. And then we're going
Yeah,
to see the function of the body improve. And it's just this beautiful way that we feel that safety and feel that trust.
yeah.
So
Sometimes what
I'm
can
gonna go back to these things.
Yeah. Well, I was going to say, so you asked for some pointers and what can help. So again, like I think education and just teaching people about their bodies and how amazing they are. And sometimes it's just, we weren't raised like that. We were raised to, no pain, no gain.
Yep.
Beauty is pain. But I also think that I lost my train of thought. I forgot what I was going to say. Oh,
Pointer.
yes. One thing that I have found that's really helpful is sort of taking yourself out of the situation as the patient, allowing them to sort of reflect on their own relationship like they would any other relationship in their life. So if you talked to your significant other or your best friend the way that you talk to yourself, whether it's about a choice that you've made or the things that you're observing about your body, how would that relationship be? And so sometimes just that reframe can be really helpful at allowing them to have a little bit of a better, more just a kinder narrative with themselves.
Beautifully said, because I think many of us probably would agree we would never say the things we say to ourselves to our best friend, our sister, our daughters.
Yes.
Yes, very, very prime example there. So, I think a lot of times when we're doing our preconception care, like we've identified that we want to get pregnant, it does make it somewhat more motivating to make these behavior and lifestyle changes because we have a goal that is very clear and solid, and it's something very tangible to work towards. Do you find that in practice too? Like the preconception time is so motivating.
Oh, for sure. Absolutely. Yeah. Because I mean, the payout at the end is enormous. Like you get a baby. Yeah.
Hmm. What about our patients that maybe they feel some of the symptoms you talked about, the hair loss, the
Hmm.
cold? People will tell me like I'm the cold friend when we're in a group setting. All my friends are fine, and I have 5 sweaters on, and I need slippers. What about people who feel those symptoms, but they're like, I've been told my thyroid labs are normal,
Hmm.
but I'm still not getting pregnant. What do we do now?
Yeah. Well, I mean, I would say if your labs are normal, but you're not feeling normal, then that's not normal. And so that's where casting a net that's like a little bit wider and deeper can be really helpful. And so I think that's where sort of thinking outside the box and assessing other lab parameters and other symptoms and being able to connect those dots can be really helpful. But even in the context of a thyroid panel, Are you looking at the lab ranges, or are you looking at optimal ranges? And are you having a cohesive story be told, or are you looking at one isolated marker? The body with the symptoms is telling you a story. And as practitioners, our job is to understand and interpret what that story means. And so sometimes it means combining the symptoms, your story, and the lab tests, and kind of like weaving that together to really get the big picture of what's going on.
We always have to marry lab values with the patient's lived experience.
Yes.
Right?
Yes.
You've mentioned before and talked about some of your patients with hypothyroidism, they don't actually have a thyroid issue as the primary source of their health concerns. And I think anyone who's listening and like they've been diagnosed with hypothyroidism, like, what do you mean the thyroid isn't the primary issue?
I know.
Please walk us through this.
Oh man, I'm going to get a lot of flack for this, but this is a hill that I will die on, because
this is a safe space, Nicole.
I hope that this is more enlightening and empowering as opposed to frustrating, because if you've been diagnosed with hypothyroidism, you're like, oh, my thyroid. I would venture to say that in most cases, it's not a thyroid problem. Your thyroid is probably just fine, but it probably doesn't have the tools that it needs to do its job very well. Mm-hmm. It's sort of like having a brand new, beautiful Corvette in the garage, but it doesn't have tires or it doesn't have gas. Like, good luck using it.
Right.
So that's sort of like the majority of the people that we see in clinic are people who don't literally have a problem with their thyroid. It's more other things that are influencing their thyroid to be underperforming for a reason. So when I say that it's not a thyroid problem, that's what I mean by that.
Mm-hmm. I actually feel like I'm kind of relieved to hear that, because I think a lot of us, when we get diagnosed with something, hypothyroidism as the relevant example here, we picture like our thyroid is just destruction everywhere and like inflammation going crazy and it's just wasting away. That's not necessarily what's happening here, right?
Right. And I don't want to take away that, yes, if you've had years and years of horrible autoimmunity, perhaps there is thyroid damage. If you've had part of your thyroid removed because of cancer, yes, it's a thyroid problem. But I would say a large majority of people who are dealing with hypothyroidism, that's not the case. It's usually something else. And the silver lining with that is that it's fixable, because it's oftentimes related to nutritional deficiencies, stress, gut health issues, inflammation. These are things that we have control over. Even under the Hashimoto's umbrella, it's autoimmune, which can seem daunting because, golly, it's the immune system. Like, how do I fix that? A lot of our immune system is adaptive, and we can either leverage that in a good way, or we can do nothing and allow it to continue on that path. But I like to sort of seize that opportunity in the fact that it's adaptive and use that to our benefit to allow our immune system to adapt in a good way, meaning that it's going to slow down, if not stop, that autoimmune process.
Yes. This is the perfect time for a listener question.
Okay.
I opened it up on Instagram and said, Nicole's coming on the show. What questions do you have? And someone wrote in and said, I've been diagnosed with hypothyroidism. How do I know if I have autoimmune thyroid disease? Will you give us the scoop?
Yeah. So the straight answer would be testing for antibodies. And so if we're talking about hypothyroidism, usually that's going to fall under the Hashimoto's umbrella. And so the two markers that are assessed the most commonly are going to be anti-TPO and anti-TG, which is anti-thyroid globulin. And so most commonly the anti-TPO is done. I prefer to have both done, because sometimes there are people who have normal anti-TPO, but they have really elevated anti-thyroid globulin. And so those two together, I think, can be very helpful in either identifying or ruling out.
Really, really helpful. And a lot of times I find patients come to me and they maybe have had a positive antibody before, but they didn't realize that their hypothyroidism was autoimmune in nature. And that gives us an opportunity to walk through what that means, maybe connections to things like leaky gut or intestinal permeability. And then we can start to walk through the lifestyle things that could actually improve our immune function. So thank you for clarifying that. That's the perfect intro to our next listener question. This one says, I have Hashimoto's and I'm trying to conceive. I recently started on levothyroxine, which, if this isn't familiar to all the listeners, that is a synthetic form of T4. Do you ever see patients who can come off this medication at some point?
I do. Yeah. And that's definitely something that you would want to work on with your prescriber. As dietitians, we don't change medication, but what we really focus on is your body's ability to regulate the immune system, especially in the case of Hashimoto's, the body's ability to produce thyroid hormone and the body's ability to absorb and convert and utilize thyroid hormone. So for many, many people with the correct course of action, yes, it is a possibility. That it's not a guarantee for everybody, but it absolutely is a possibility. But it's something that you would want to do in conjunction with the prescriber who's prescribing the medication.
Yeah, I think the take home is it's possible, right?
Yes.
And related, we had another question, similar, but a little bit different. I want to know if hypothyroidism can be reversed, even though I've had this for 10 plus years, but I have no antibodies. What do you think?
Yes. Yeah, well, I'm glad that first and foremost, she's ruled out whether or not it's related to autoimmunity. So when I have somebody who comes into clinic and they're like, I just have had hypothyroidism since I was in my teens and now I'm in my 50s, and I'm like, do you have Hashimoto's? And they're like, I have no idea. That's step number one, because we need to know what we're dealing with. And so that's where we need to start, is identifying whether or not there are antibodies. The next layer would be, okay, well, let's start to dig into where this hypothyroidism came from. Do you have a history of cancer and you had to have it partially or totally resected? Well, the likelihood of going off medication in that case, slim and none. It's not going to happen. But if it's unrelated to that, if it's more related to like, wow, you have a severe deficiency in iodine, or maybe you have a big deficiency in vitamin D and magnesium, your body needs those building blocks to actually make thyroid hormones. Or maybe there are other root causes. Maybe it's a lot of stress and past traumas or current traumas. Those stressors inside the body are going to turn down the production of thyroid hormones as a metabolic adaptation. So I think there, again, yes, it's possible with an asterisk. We have to understand why you developed hypothyroidism in the first place. And, I've had people who've had hypothyroidism for 1 year and 20 years, and the length of the time isn't necessarily problematic. It's more about, well, why did it happen? And then what can we do about it?
You mentioned earlier in this episode, it's the curiosity, like to come to these cases with a sense of curiosity and asking the right questions is everything to get to really those underlying drivers.
Yep, exactly.
Of course, we got to talk nutrition because that's our shared love language. So what are some of the most important nutrients that anyone should focus on to support the health of their thyroid?
Absolutely. So nutrients, I this year put on my professor hat and I started teaching a college class. And it's an intro to nutrition class. And so I'm like teaching this to college students right now. And so I'm like really passionate about this. That like nutrients is actually like a pretty broad term. And so we have what are called the macronutrients, like proteins, fats, and carbs. And those are essential, meaning that we absolutely need them. So I would say my first answer to that is, are you getting proteins and fats and carbs, and ideally some veggies in there? And so I would say that in practice, what I see typically the most undereaten is protein. And so I don't want to generalize, but I would say that most people aren't hitting protein goals. And so the second nutrient that I would say is has kind of a tense relationship would be carbohydrates. And so we see a lot of clients who have either been very low carb or maybe they're just all over the place with the carbs. And so balance with those nutrients is very critical. Then we have what are called micronutrients, and those are the vitamins and minerals. And there are several that are needed in that whole thyroid hormone journey. But if I had to pick a couple of favorites, iodine would be a really big one. But that one can be a little bit touchy with Hashimoto. So that's not something that you just want to willy-nilly start taking iodine. Other things would be vitamin D, zinc, magnesium, potassium, iron, tyrosine, just to name a few. There's several. What I find is the most helpful is to be able to not just test your lab values of these, but also have your diet analyzed to make sure that these nutrients are coming through your diet. So kind of a loaded question that I could go on and on and on about, but those would be the top ones that I would be interested in looking at.
Yeah, it's great. I love it. This is a question from my own clinician brain. I want to know what you're doing in clinic. When you're looking at someone's diet, how many days are you looking at? Because I struggle with like a 1 day snapshot because the next day could be totally different. What are you doing over there in the real world?
Yeah. Well, you have to remember that like we're dietitians, and so our hyperfixation is food. So when we're working with people, we are with them basically every day, seeing what they're eating. And so like we have clients keep daily food logs if it's helpful for them, and they
Yep.
eventually graduate to the point where they don't need it. It's kind of like wear the training wheels for a while until they feel very confident doing this on their own. And so I think that there, yes, is value in getting a 1 day or a 3 day, but because our job as dietitians and nutritionists is to focus exclusively on food, we have the benefit of focusing exclusively on food.
Yeah.
And so we're able to see their day in and day out intake.
Very cool. Okay. All right. Well, I'm still going to do my couple days and crunch my numbers over here and do what I can.
Yes, that is good.
Related to nutrition, I got one more listener question for you. And I picked this one because I think this comes up all the time. This person said, my TSH is stable now. So it sounds like history of hypothyroidism, maybe an elevated TSH. It's good now. But I continue to have severe hair shedding. Any particular nutrients I should focus on?
Yes. Before I answer the direct question, I have to go back to like my TSH is normal and suggest if you haven't had a full thyroid panel, like that absolutely needs to be done.
Yeah.
And because what can happen is, your hormones could be low and your TSH be low because maybe there's a lot of stress going on and your brain is protecting your body because of all the stress by not secreting the TSH. So I'd say you want to get a full thyroid panel done. And then that next layer of, well, let's look at some nutrients. The ones that I would say to be tested via blood that I would want to look at would be iron, vitamin D, magnesium would be another one. Let's see, I really like looking at the red blood cell potassium. And so that's something that's really, really important for pulling your thyroid hormones inside your cell. A blood panel is going to look more outside, and we want to know like, well, how well is it getting in? And if there's like not enough potassium in the diet, that could prevent the absorption of it. I'd want to look at calcium levels as well. So I think I've hit the majority of them: iron, vitamin D, red blood cell potassium, magnesium, copper and zinc, vitamin A. Those would be the biggest ones that I would look at.
What's nice too is the ones you're mentioning are pretty widely accessible. Like these are the things you can order in the blood. It doesn't take like the very, fancy functional testing to get a lot of these. And so that makes it really nice and approachable.
Yes. I mean, I'm all for the fancy, like full micronutrient panels, and we do that a lot. But if you're like, man, what the heck is going on with my hair? I want to get some blood labs done at my doctor. Like these are very accessible labs that are done or could be done routinely.
Yep. I like to surprise my guests with a fun question at the end. And I personally am in a breakfast rut right now. So I'm going to put you on the spot and say, can you please tell us a thyroid supportive breakfast that you would eat in your house and is delish?
Absolutely. So eating breakfast is like step number one. So to support your thyroid, you need to be eating breakfast. Step two would be to make sure that you're getting proteins and fats and carbs at breakfast. You need those essential macronutrients. So ideally getting like 20 to 30 grams of protein and getting carbohydrates from a good quality, colorful carb source. So that could be something like eggs and sweet potatoes. Something that I've been doing recently is I'll do a cup of bone broth to give me some protein and minerals. I have a gluten-free sourdough starter that I never actually use to make bread. I just cook the starter, and it's so warm and delicious and like bready. And as somebody who's been gluten-free for over a decade, it like just is heaven on earth.
Yes.
So I'll do some like chicken sausages with the bone broth and then the gluten-free sourdough discard. So I'm hitting my proteins and fats and carbs in that meal, and it's delicious.
And it checked all the boxes.
Yes.
Before we started recording, listeners should know I was trying to peer pressure you to get a chicken so that you could have those eggs available. So we're going to check in with Nicole in a couple of years and see.
Yes, give me some time.
Chicken.
I'm still acclimating from city life to suburb life. So I need a little bit of time before I'm like a chicken lady.
But all chicken ladies unite for this beautiful thyroid breakfast. Nicole, tell people where they can find you if they want to learn more about all things thyroid health.
Yes. Yeah. So my Instagram is Choose Food Wisely, CHEWS Food Wisely. I am a big believer in empowerment through education. And so I feel so honored to be able to share my Instagram as an educational platform to help bridge the gap, because golly, hypothyroidism is so rampant. And I feel like while there's so much information, there's so much bad information and just overwhelming information. And so I want to eliminate that and give you realistic, tangible, sustainable, realistic action steps, all wrapped up in a science-backed approach.
Yeah, well, I just will co-sign. You were an excellent teacher.
Thank
The
you.
way that you educate, it's so approachable in a way that it's not fear-mongering, it's empowering. And I think that is such an important skill, and I really appreciate that. So we just have been delighted to have you on the show. I wanted to take this opportunity to thank our listeners for choosing us as a trusted source of information. To our show's producer, Paula, love you. Thank you for making our podcast dreams come true. And Nicole, thank you for spending time with us. It's just been a pleasure to be with you.
Yeah, likewise.
We'll see you all next time, everyone. Did you love this episode and want to hear more? Head over to drkaleawattles.com/podcast, where you can find more episodes on all things fertility.